welcome back. This is your Feel Good Breakfast Show, indeed, only on SABC3. Thank you for tuning in. Now, if you are suffering from a chronic condition like high blood pressure and experience feelings of isolation or worthlessness, constant fatigue, or even loss of interest in activities that used to bring you joy, you could possibly be suffering from depression or other mental health conditions. And today we are joined by Mariska van Aswegen, Pharma Dynamics spokesperson, to discuss this topic that is affecting a large number of South African population who actually suffer from chronic conditions. Mariska, thank you so much for joining us this morning.
Morning.
Yeah, we heading towards the end of Mental Health Awareness Month. It was a very interesting month about raising awareness because it is a big issue in South Africa. A lot of people are actually battling with this. Now, Pharma Dynamics recently revealed research findings that showed mental health in the country is on the increase, all right, and that is also due to, you know, a larger number of antidepressants being available. To what do you actually link this increase?
If we look at the increase in antidepressants being used, it can be linked to an increase in diagnosis, which is a good thing because the first step is to find help if you do suffer from a mental health condition. But what we also see and what medical research and experts tell us is that this link can in part be linked to an increase in chronic illnesses. If we look at what causes depression in chronic illnesses and also at research at the statistics, comparing those statistics to the risk in an individual that is seen to be healthy, then you can directly link the increase in the use of antidepressants and the diagnosis of depression also to the increase in chronic illnesses.
Because it is a shocking statistic. I'm reading it right here. Chronic disease is becoming one of the highest causes of death in developing countries, up to 40% of deaths in South Africa. So there's definitely a clear link between chronic diseases and mental health issues.
Absolutely, and latest research from the MRC in South Africa is that your non-communicable diseases, your diseases of lifestyle, actually cause as much death in South Africa as what your communicable diseases, your HIV/AIDS, TB cause. So they're on par with those conditions at the moment. And if we just look at you know, how these conditions change your life, it can be devastating to learn that you suffer from a chronic condition. The idea that you will have to take treatment for the rest of your life for this condition, it can be devastating. It can affect your everyday life. It can affect your appearance, your ability, your independence can be affected. And that's why besides the fact that depression can be caused by various other factors like genetics and biologics and environmental factors and then psychological factors as well, chronic illnesses is directly linked to an increase in risk to develop mental health issues.
Give us some of the stats. I mean, you know, what is the risk of depression when individuals who suffer from chronic illnesses out there? You know, how bad is it in South Africa?
To put things into context, it's important to look at what the risk of a normal individual is that's deemed to be healthy. And in normal individuals, women have a risk of about 10 to 25% to develop depression, and men have a risk of 5 to 12% to develop depression. What research shows us, a person who suffers from a chronic condition has a risk of 25 to 33% to develop depression. And from studies, we know that a person who suffered a heart attack, or 40%, almost 40% of people who suffer from a heart attack develop depression. If we look at cancer patients, 25% develop depression. Parkinson's, also about 40%. So it's really conditions that changes your everyday life, your abilities, that really lead to mental health issues.
Well, this really is such a big topic to talk about. We are wrapping up Mental Health Awareness Month, like I said a little bit earlier on. So how do we go about promoting mental well-being when we talk about resilience to things like stress, anxiety? I mean, what would your opinion, your message be to South African public out there?
The important thing is to realize that you need to maybe relook your goals. You need to maybe find your new reality and make peace with your new reality. It's important to remember that depression can be caused by various factors, especially if you suffer from a chronic condition, and that can be even side effects of medication. It can be the disease itself. It can be the changes in your ability or your mobility, your independence, as we've mentioned before as well. So it's important for you to understand your changed environment, to find opportunities in this new reality, and then also to find help if it is necessary. If your condition or your symptoms of depression worsen, talk to your doctor. They may prescribe medication, or they may refer you to psychotherapy just to help you to deal with those feelings of depression and anxiety.
Because the worst thing you can do is to shut yourself off from the rest of the world when you are feeling like that.
Absolutely. Isolation is really dangerous when you do have these feelings of depression.
Perfect. Thank you so much, Mariska, for joining us this morning. Really appreciate it, and also the hard work that you are doing to promote mental well-being. Well, as October draws to an end, so does Mental Health Awareness Month. And if you are watching this morning and you feel like you're suffering from depression or any other mental health issue, you can contact Pharma Dynamics toll-free helpline on 0800 205 026. Right now, though, let's take a look at what is trending online with the ladies.